So today's conference gives a very brief snapshot of some of the most recent examples of our community health-oriented research, although there are many more projects in progress and about to start. We have a school website and a school research newsletter which is published 3 times a year, and it's fantastic to see our publisher here, which is fabulous, Claire, and please always kind of check into that because you'll always see the latest stuff that's coming up. And if you're interested in connecting in with us more, we would be delighted to hear from you. So just finish off with just some housekeeping for today. We're conscious that this is a really condensed conference and it's bang, 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 and we're going to be moving at a fairly brisk pace. We won't be stopping for breaks, so it means if you didn't stuff your pockets with pastries at this stage, you're kind of screwed really until 1:30. No, seriously, there will be opportunities. I mean, you can nip out and have a coffee and a tea as the morning goes on. Just if you wouldn't mind just timing when you come in and out, like maybe between presentations would be great. We will have sandwiches and wraps arriving at around 12 o'clock, so you won't be totally starved. And again, if you want to just bring them in and we'll have a kind of working lunch. So this is all part of our neoliberal world, folks, you know, where you just kind of, there's no time to stop. Okay, so do take time as if you can to, I know some people were looking at the posters already, but you know, enjoy the posters from staff, students and our practice and research partners. So without any further ado, we'll get started. And I'm really delighted to introduce Dr. Collette Bonner, who's our keynote speaker today. And I know she didn't want me to say that she was a keynote because it kind of puts the pressure on. But I have no doubt I've seen Colette's presentation and it certainly is a kind of very, very interesting and impressive stuff that she's going to be talking with us about today. Colette's the Deputy Chief Medical Officer in the Department of Health, and she's got a special interest in the area of health protection, which is really opposite for our stuff today. She's been centrally involved in the CMO office response to the management of the national COVID-19 emergency, which involved a whole of government response. She's worked on the area of climate change and health since 2014 and was one of the key authors of Ireland's health sector adaptation plan. Colette's breadth of expertise and interest speaks to many of the themes and the concerns of our conference presentation today. We're so pleased that you could join us, Collette.
Okay, well thank you to Bridge and Mary Rose for inviting me to present at your conference today. I'm absolutely delighted to be here. I will be able to stay for most of the conference, but unfortunately I have to leave a little bit early. So apologies about that to the speakers that I won't hear. So I just want to, sorry. How do I shift?
Be okay with the arrows?
How do I? I'm not sure.
Yes.
Is that going to shift?
So, yeah.
Or even just that one,
yeah.
or whichever one you like.
2 arrows left and right. Yeah.
Okay. Okay, so today I want to take you through some of the public health challenges that are presented in the National Risk Assessment, the overview of strategic risk. Now, this is a document that is prepared by the Department of the Taoiseach, and it's generally an annual or biannual basis, and it involves a public consultation, so there's a lot of consultation and thought goes into this work. And what I've done is I'm going through some of the risks that are mentioned in the National Risk Assessment that I see as the key public health challenges for Ireland presently and maybe into the future, but by no means is this an exhaustive list at all. So since the last iteration of the document, we've had various challenges, shall we say. We've had the global pandemic, we've had Brexit, and we've also had a cyber attack, which some of you may have been affected by. Now, according to the National Risk Assessment, the report or the document divides the risks into 5 key areas. Okay, so geopolitical, economic, social, environmental and technological. And what I have done is I've taken some of the public health risks from all of these, because all the categories include risks to public health. So just to start with geopolitical risks first, the most obvious one that you'd all be aware of currently is the conflict in Ukraine, the illegal invasion of Ukraine by Russia, which commenced 6 months ago. So what impacts does that have for Ireland and for health services and for public health? And that is, we've had 43, well, up to July of this year, and I don't have figures from beyond this, but up to July of this year, we had 43,000 Ukrainians who had arrived in Ireland, 1,400 arriving every week. So we will be seeing up to 60,000 by the end of the year. And what are the impacts of this? Well, I mean, housing is obviously the most obvious one, and we're very well aware of that. And it's also been well publicised that there have been difficulties in relation to that. But then there are other things that these refugees will have to cope with as well. I mean, health status. For example, infectious diseases incidences would be different in Ukraine than they would in Ireland. So, for example, tuberculosis and multi-drug resistant tuberculosis is much higher. So those are the kind of challenges that we face, because obviously then there is a risk to an increase of incidence of TB in Ireland. Also, we have the Ukrainians by nature are generally vaccine hesitant, and as a result of that, their vaccination status and even their uptake of childhood vaccinations are low. So that's another challenge, obviously, because the re-emergence of infectious disease is a huge challenge for all of us. As well as that, then, of course, there are all the problems that the refugees have to face themselves, like the mental health difficulties about leaving loved ones, about leaving a conflict zone, about what they have seen, what they've had to cope with, education and language barriers, and then, as Bridge has talked about, that whole area of social inclusion and becoming part of a community and feeling part of a community and feeling supported. So those are all major challenges. Now, in relation to economic risks, I suppose the important thing about economic risks, and I think we're all aware of what happened in 2009 and 2010 with the banking crisis. But I mean, we know, and it's well known, that economic status is a social determinant of health. And I mean, economic shocks like this war in Ukraine is causing global economic shocks. I mean, we've increased fuel and commodity shortages. We have increased inflation as a result. We have disruption of energy supplies. So, I mean, all of these things do affect people. I mean, one of the obvious ones would be employment, for example. I mean, with when the economies go down, people lose their jobs, and people who are unemployed generally have poorer health status and than people who are employed. So these are all things that we need to be thinking about, both now and into the future. Then the social risks, and there's a couple in this that I really need, I just want to highlight. I think, and Bridge mentioned this as well, I think one of the most important ones is demography. The early 2022 census suggests that we have over 5.1 million people living in Ireland now. But it's the composition of the population of Ireland that is an important issue. Adults over the age of 65 years are increasing at an average of 20,000 per year. And we expect that they will, as a percentage, they'll be 20% of the population by 2038. Also, 25% of our population are under 18 years of age, and this has implications for our dependency ratio. So, I mean, it's really important for us to have people in the bracket between 18 and 65 who are working, because they're the people who pay taxes, they're the people who who pay the taxes, that give the money to keep our public services going, to keep our pensions going, etc., etc. So, I mean, that's a really important issue into the future. In relation to life expectancy, it's really good for Ireland at the minute. Women, I can't read that. Oh, can I read it? I can. 83.6 years, and men 79.9 years, well above the EU average. But I'll come on later to just talk about groups that may have much reduced life expectancy due to the social circumstances that they live in. Homelessness, housing and sustainable development has also been mentioned in this one, and that is just to talk about homelessness, and I know there's a couple of presentations which I hope to be able to stay for later regarding that, but over 10,000 people are homeless in Ireland. In July of this year, that was the figure that was quoted. 1,300 are families, and 3,000 of these are children. So those are really pertinent, important issues for child health going into adulthood in the future. Digital exclusion, I'm not sure if you know what that means. I didn't know what it meant. I had to look it up, actually. But anyway, you guys probably do know, because it is something that would be talked about in the social inclusion space, but essentially it's where everything is online now, and all our messaging and everything, and people are getting all their health promotion messages and stuff through digital channels. And of course there's a swathe of the population that don't use IT at all. So that's an important issue that we just have to be aware of. So just at this point, I just want to mention Healthy Ireland and talk a little bit, well, just not really talk about it, but just mention to you guys that that's the framework for, so that's our framework for our roadmap for building a healthier Ireland. And as Healthy Ireland is part of a suite of Department of Health policy areas, Sláinte Care being another one. And I just wanted to mention them to you just briefly, just so that you're aware. And I think that this is all about the health of the population. It's about community health. It's about people, everybody having a high status of health, and it's all based around the social determinants. And that's why I feel that the courses that you run here and the new MSc and social inclusion are very relevant to the policy direction, of health in this country. Sláinte Care is another example of it. And under Sláinte Care, we have set up an enhanced community care programme. And again, that very much speaks to the courses and the skills that you're providing practitioners with here, because that is really where the future is. We need to bring health down to the local level. And so I just want to congratulate you on that, and also to wish you all the best for your new course that will be starting in September. Again, just really about what Healthy Ireland is, and I suppose just one of the key things is the reduction of health inequalities. So as I say, your courses I think are very relevant to that. It's all about creating partnerships. It's all about community engagement, and that's I think what you guys do very well. I just also included just some data sources here in relation to health inequalities that you might find useful during the year. I'm sure you may be aware of them. I think the Health Atlas Ireland, and apologies, Anthony probably knows more about this than I do, but essentially it's a HSE atlas which brings a whole lot of data sources together, and you can actually then look at county level at the health status of the population based on performance indicators that are in Healthy Ireland. So like uptake of screening services, for example, air quality, for example, is another one that can be looked at. And more recently, Healthy Ireland in the department are working at trying to bring that data down to a local county council level. So that brings it into even smaller populations. And I think that that's really important, because we know that big data sets can look good, but they unmask what's really going on within actually small parts of our communities. And again, it's all about engaging society, and I think that your courses really teach practitioners how to go about that, and how important that is. Technological risks then really this is just based around, I just wanted to mention it because we can't get too dependent on technology, because we did have that cyber attack in May 2021 that caused huge disruptions within the HSE, and I think in some other government departments, and I think it's really important, and it led to reduced continuity of care. It took a long time for that to be managed. So those are just the risks that we need when we're thinking about IT solutions for anything. We just need to remember that there are risks with that as well. Now, going on to environmental risks, again, there's a couple here that I want to talk to you about specifically. One of them is just about the re-emergence, the infectious diseases and the re-emergence of infectious diseases, and the second one then relates to climate change and health. Just on well, we all know how much the pandemic, how much that affected all of our lives. I mean, I don't think any of us would have known in 2019 that for a two and a half year period that we were going to be so restricted as we were. I wrote these papers, I read them, but I never lived them. You know, until you live them. I mean, lockdowns were terrible, and again, the lockdowns, I think, was something. I think that was a really negative part of the pandemic for me and for everyone else, and I think that it's also the bit that probably increased the inequalities that we're seeing in health and even in education going forward. Then just an overview of that. I'm sure nobody wants to hear about it, but to date we've had about 1.66 million cases in Ireland, and that's a huge under-reporting because our whole testing strategies, etc., have changed hugely. So we've had 7,782 deaths, and I think the important thing to remember is that the pandemic, we still have a pandemic. The pandemic isn't over. WHO have not declared the pandemic over. I mean, we know that we've got the Omicron B5 variant at the moment. There is a very strong possibility. Every 6 months we seem to have to look at a new one, a new variant. So, I mean, we are expecting that we will have a surge again in the winter time. And just in relation, our vaccination program was super, and that was one of the real key success stories of that time. However, I suppose vaccine hesitancy is the thing that really worries me now. I mean, we're now the National Immunisation Advisory Committee, and I sit on that committee. We have advised second boosters and third boosters at this stage, but you know, people don't see this now particularly as something that they need to worry about, and as a result, our uptake of boosters is definitely reduced. Now, we are going to have access to new adapted vaccines soon, which are a little bit more specific for some of the more recent variants. So we're hoping that will improve people's perception, of immunisation and taking vaccines. But the whole vaccine hesitancy thing, I think, is a risk for the future, because it's not just about boosters and COVID vaccination, it's about childhood vaccinations, it's about all of these. And I mean, these are crucial to maintaining vaccination status, in the population for diseases that we have eradicated is crucial to them remaining eradicated. So that's just something that we need to keep an eye on into the future. And just to remind you all of what the current public health advice is, it is all about personal responsibility, nothing mandated at the moment, but I mean, anybody who feels they're at risk, etc., should always feel free to wear a mask, and the respiratory and hand hygiene, all of that is really important, and staying at home when you have symptoms is another key area, and especially in the school situation, so that we are able to maintain our education system. Now, the other infectious disease I want to talk about is monkeypox. I don't know if any of you are aware of this disease, but this was a disease that was endemic in African countries, and we had never seen it in Europe, except if it was related to travel. However, since April, May of this year, we have Europe has been monkeypox has emerged in Europe, which is not related to international travel. To date, I said 126, we actually have 144 cases up to this week of monkeypox. The cases are generally in males, young men, and most of these people would identify as GB, MSM. So again, that's a very specific community, and so although we want to give general messaging to the population, it's really important that we talk specifically to the groups most at risk. And you will be aware that there are quite a lot of young men who are probably very vulnerable in this situation. So getting those messages out to them is really, really important. Just from a Europe point of view, over 18,000 cases in Europe. large number of cases in Spain, in France, Netherlands, etc. In relation to the disease itself, not terribly, okay, we say mild, okay, but I mean that, when we say mild, it means that people generally don't require hospitalisation. However, we need to be really careful about that term, because we do know that people who have experienced this illness, it's a very uncomfortable, painful illness. So, you know, we need to be aware of that and be empathetic whenever we talk about mild disease, because, you know, if you have monkeypox, you don't think it's a mild disease. But the important thing is that people haven't required hospitalizations. We do have antivirals available to us if we have a very seriously ill patient, and we do also have vaccines. You'll know that I don't know if you're aware, but there's a huge global shortage of monkeypox vaccine. It's the vaccine that we used to give for smallpox, and it has been repurposed for monkeypox. And there's a huge global shortage, as I say, and so now we offer vaccine to the contacts of someone who has been exposed, and generally better to give that within 4 days. But now we are offering vaccine to the high-risk groups. So we have to identify within that high-risk group, GBMSM group, like who are the people who are most at risk, you know, of serious disease if they get monkeypox, and also then maybe those people most risk of exposure. So that work is ongoing at the minute, and that vaccination has started. So, but as I say, we don't have enough for all of that group at the moment, and we will run out of vaccine before the end of the year, but we're hoping to get new supplies by December, January next year. And that takes me on to then talking about the other environmental health threat, which is the one that has been with us for a long time, and it was identified by the WHO as one of the greatest challenges of our time, climate change. And just in relation to that, I think the Intergovernmental Panel on Climate Change, which was set up in 1988, is really the expert authority in relation to climate change. And they have determined that the warming of the atmosphere, the ocean and the land since pre-industrial times is related to the emissions of greenhouse gases, which is due to human activity. So it's what we have done to the planet ourselves. We have to take some responsibility about what we have done to the planet, and that has caused an increase in 1 degree above pre-industrial levels. And what they have said is that in order to even limit that warming to 1.5, it would require huge, unprecedented changes in all of society. The good news about that, though, is that in the Paris Agreement of 2015, 197 countries committed to undertake these ambitious targets, both in the area of mitigation and adaptation. So that was really good news. So what does it all look like then for, and what do we expect in Ireland? That information is provided on the Ireland's Climate Information Platform, which is supported by global simulations carried out by Met Éireann. So if you go onto that platform, you can see the types of things that they are projecting is 1 to 1.6 increase in annual temperatures, which is a good thing from the point of view of the growing season. And I'm sure none of us, we all love a little bit of heat. So we all think, well, that's a great thing. However, we also would expect heavy precipitation events, which in winter, which of course we know leads to flooding. We also would experience reduced periods of precipitation in spring and summer, or spring and summer, and of course that leads to droughts. And all of those things, you know, have environmental effects which lead to health impacts. Again, another one is an increase in sea level around our coast, and you know, this is an important one from the point of view of in the 2016 census. It's been shown that 40% of the Irish population reside within 5 kilometres of the coast, and 40,000 live within 100 metres from the coast. So those are just important issues for the future. I mean, if we continue to have these changes related to climate change. So again, just to synopsize that, rising sea levels, increased temperature, more extreme weather events and increased precipitation. So these are the things that we have to, first of all, try and reduce these effects, but we also have to adapt to some of them. Now, the health impacts, as I said, is actually related to how that affects health is it's a kind of like an environmental exposure pathway. So, I mean, the climate changes, and that changes weather events, which has environmental effects, which leads to influences on health and then health impacts. So that's how health becomes affected. And it's really, I suppose, it's that delicate ecosystem. When we upset the ecosystem, I mean, everything is so intertwined. The one health concept, you know, of the environment, animal health and human health, they all are so intertwined. And I mean, I think that we're all realizing now just how important that interaction is. That's a busy slide, but essentially what it has there on the, is that your right or your left hand side anyway, is the changing climate effects. So if you look at the extreme weather events, the environmental effects that it causes, like disrupted communications, power supplies, sanitation, etc. Rising sea levels, unsafe roads, flooding, changes in precipitation, drought, flooding, etc. Warmer weather includes heat waves, increased exposure to UV, decreased air quality. So all of those then on the right hand side of that slide then show you all the different kind of health impacts that are you know, that those will cause, and some of those will be acute during the actual severe weather event, and others are more longer term. So like, for example, air quality, I mean, the effects of air quality, poor air quality, you know, are ongoing. The effects of UV, increased exposure to UV, obviously, is an ongoing risk as well. Just in relation to the scenario separately, looking at the severe weather events, I mean, I suppose the one that we would have been most familiar with, and probably, I think probably people don't remember much beyond the pandemic, but in 2017 we had Storm Ophelia, and that was a severe storm. We had I think there was a stay-at-home mandate for that day because it was considered to be one of the most severe storms that was going to hit Ireland. But even despite all of that, we had 3 deaths due to falling trees. We had disrupted services, up to 300,000 people without electricity supply. As a result of that, we had some water treatment failures, and you know, for some months afterwards, boil water notices because those because of those water treatment failures meant we didn't have safe drinking waters in certain parts of the country. Then in relation to flooding, again, you'll see just the effects that can have. So there's the acute risks, just in relation to getting drowned. I mean, and I think we did have a drowning, I think, of a young Garda a few years ago during a flooding event. He went to help rescue somebody in County Wicklow, and he was drowned in just the surges of water that were in a small river at that time. So, I mean, these are real risks. Hypothermia, carbon monoxide poisoning. Then the disruptive aspects of it, which is lack of access to services, health services for people, say, who are extremely ill. I mean, are ambulance fleets resilient, you know, to be able to function in those kind of situations? And then there's a recovery gap. So people, for example, and I'm sure you'll have seen this in relation to some of the flooding events we had around the Shannon a few years ago. But I mean, people are left, like, even when the event is over, people are left, you know, having to re-modernize their houses. You know, they don't have accommodation, they can't get insurance, all of these things, and these lead to mental health effects for people as well. And it has been shown that there has been an increased attendance at primary care services following events like this, mainly due to the fact that people are so traumatized and anxious and depressed as a result of what's happened. So these are all considerations that we need to take into consideration. I suppose you're all aware of what's happened in Pakistan, a third of the country underwater. I mean, that's really that is concerning. Then drought, again, the types of things that we can expect with drought. We have huge drought conditions in Europe this summer. And I mean, obviously that leads to waterborne and foodborne diseases. There's also the whole economic loss, I mean, of crops, etc. What does that do? That adds to our commodity prices. It adds to our inflationary prices. You know, and that's going to be a huge issue, I'd say, certainly for this winter and going forward. Also, I think the Rhine is one that has at the moment hasn't enough water in it, so shipping can't pass. So as a result, commodities aren't able to get to their destinations, and either, you know, that means it's an increased cost because you lose those commodities. Some of them are fresh stuff that is lost, or they have to re-divert them, which is more expensive as well. So, and then there's a whole area of wildfires, which leads to injuries, and you'll have seen those in Europe this year. I mean, that's people having to leave their houses, they lose everything, and also the whole aspect of air quality and air pollution. And just in relation to heat waves, similar type of things, but there's the acute stroke, there's the acute heat stroke, which needs obviously to be treated or to be prevented, really. And the more longer term one then, of course, would be exposure to UV, and that is like in Ireland there would be 11,000 skin cancers which is related to UV, right? That diagnosed every year, and that is expected to increase or double by 2038 or 2040, and that's not even taking climate change into consideration. So you know, that shows you that there's a changing demand for healthcare. I mean, we will need to look at that, need to look at more dermatology people, you know, more people who can treat that type of scenario. Also, again, higher healthcare utilization during you know, periods of heat waves. And then, of course, all of these situations, but especially heat waves, they contribute to poor air quality, and that increased respiratory risks, and especially for people who have asthma. And we know we have a large number of asthmatics in this country, and people with chronic obstructive pulmonary disease. So the aggravations of their conditions as a result of the environmental effects that ozone, etc., produces during heat waves. Again, cardiovascular risks, and one of our consultants in public health medicine looked at the effect of poor air quality, for example, on admissions to hospital, and he used the Environmental Protection Agency air quality index, and they showed that in areas where there was poor air quality, there was actually increased admissions to hospital with both respiratory conditions and with atrial fibrillation, which is obviously a cardiovascular condition. So these are real risks, and again, you know, we have to define our health services in a way that we have to try and prevent these happening, but also be able to treat that changing pattern of utilization if required. Gastrointestinal risks, we're all be subject to that during, say, heat waves, etc. And all people with chronic diseases generally exacerbates those conditions. And again, a shout out for the deprived groups, and we know that they live in situations that are vulnerable, and any of these severe weather events are going to affect them disproportionately. And just one thing that we were aware of in 2003 in Europe, during the heat wave in Europe, I think there was about 70,000 excess deaths due to the heat. And one of the reasons there was, in Paris, they found that there was an increased mortality in areas of socioeconomic deprivation. And one of the explanations for that was that those areas were so, they had a very high percentage of crime and murder and burglaries, etc., that people wouldn't open their windows They couldn't open their windows in order to keep cool because they were scared they were going to, they were subject to crime. And as a result of that, there was an increase, a huge difference in mortality in those areas compared to higher affluent areas. So again, I suppose very much stressing that deprivation, and social inclusion are really important aspects across a whole range of issues. Vector-borne diseases, they're migrating northwards. At the moment, we have there's a couple of mosquito-borne diseases like chikungunya fever, West Nile fever, that are beginning to appear in parts of Italy that they have never been in before, and that's because the temperature changes is leading to the ecosystem change, which allows these mosquitoes, these competent vectors, to live and thrive. So as a result of that, we're getting these new disease patterns in Europe. The UK feel that they would have a risk of malaria, into the future with increasing temperatures, but probably the fact that in the south of England especially, but probably because living conditions, etc., are so much better in England compared to some third world countries, for instance, they probably wouldn't maybe have the same impact as it would in some of the developing countries. But it's just an interesting thing, and I mean that's something that we have to kind of be aware of in Ireland, just about that changing disease pattern, I think is really important. So what are the solutions? Mitigation, which is primary prevention, and mitigation is mitigation is the first one and adaptation the second. So mitigation, that's about reducing your carbon footprint essentially. So reducing the amount of carbon going into the atmosphere, and as a result slowing down any of this temperature increase and these environmental effects that are caused by that. However, that's not enough, because at the IPCC maintain that a lot of the changes that have occurred as a result of the already increase are locked in to our situation now. So like they are going to continue. I mean, they will get worse if we continue to, if the temperature increases, the global temperature increases more, but what we have will be are locked in, which means that we also have to look at adaptation. And essentially what adaptation is that you reduce your vulnerability to the changes that are there. So in other words, the flooding, the drought, the increased temperatures, etc., we have to look at those as events and look at how we can prevent them and how we can minimize harm as a result of those, and that's what adaptation refers to. So Ireland's domestic climate policy, well that's actually dictated, or sorry, not dictated, I shouldn't say that because it's a very a collaborative process, but it's the Department of Communications, Climate Action and the Environment is the lead government department with responsibility for climate change and adaptation, climate change, which is both adaptation and mitigation. So over the last few years, and you'll be aware of this much more recently, in fact there's been an accelerated drive on this, is the new targets have been set in legislation in relation to both carbon mitigation and also adaptation. So what is the Climate Act telling us? We have to be net zero by 2015. That's a big ask, I have to say, a big ask. Within that then there's a midterm 51% greenhouse gas emissions reduction by 2030. Like that's only 8 years. And what it means for these, this just gives you a view of the largest emitting sectors, and they would be like the energy sector, agriculture, transport. Those are the largest emitting sectors, and they really have to reduce their greenhouse gas emissions hugely by 2030. Like for the electricity, 62 to 81%, for agriculture, 22 to 30%, for transport, 42 to 50%. I mean, those are huge targets. And you'll be aware, I don't know if you're all aware of how difficult it was even to get to that. I mean, agriculture we're sitting, agriculture didn't want to take this responsibility. Farmers are worried about their livelihoods. They're worried they don't want to reduce the number of livestock, etc., etc. I think they eventually agreed to a 23% reduction. But as Mary Robinson, our previous president, I mean, who's very much involved in this area, I mean, she talks about climate justice, and I mean, we all know we want to do this, but it has to be in a way that is economically sustainable for people involved. So we have to look at what the alternatives for like farming can be, you know, so that people don't lose that sense of that's, you know, their economic livelihoods essentially. So those are really obviously like important things for the future. I wouldn't like to have responsibility for those departments. In relation to health, we come under the public sector kind of carbon footprint, and we have managed to reduce our carbon footprint from 26% in 2009 down to 18%. That's of the public sector emissions, which is great. And I really have to, at this point, congratulate the National Health Sustainability Office of the HSE, who has worked in this space, a very small staff, but they have worked in this space really since 2010, 2011, and they have managed, like they've kind of greened the whole health sector landscape. And they have got awards for some of their initiatives. One of them was they greened the whole ambulance fleet, so all of the ambulances are electric vehicles now, etc. So I mean, just so there, and I think in health that there's more we can do, and the National Health Sustainability Office, the HSE are also writing a new strategy from now for the next 5 years. So I think that'll be really exciting. But I think there's things that we can do even in the provision of healthcare. I mean, like as a medical practitioner, I have to ask myself, is it really necessary for all of the tests that we get offered, you know, both in and out of hospital? I mean, I think that we really need to look at some of those aspects. They're a bit more difficult, but they're things that we do need to consider for the future. But health's main emphasis really is on adaptation, and we were one of the 12 government departments that had to statutorily produce a sectoral adaptation plan, and that was that actually was that comes under Section 6 of the Climate Act of 2015, that we had this statutory responsibility to prepare an adaptation plan and submit it to government for approval. Next, sorry. Sorry, I seem to have, what do you call it? That it seems to just have, I think it's fed up with me. It's time I was stopping. Yeah. You've probably heard enough.
Can I ask you a question while we
Just, do you want us back on that slide?
No, that's fine. No,
So just hit this one.
Yeah.
Yes.
Oh yeah, somebody wanted to ask it.
No, I was just wondering, with the energy pricing situation we're facing into, firstly that's resulting in a huge amount more poverty, I would imagine, certainly that I'm aware of, but also in the health sector, we have all these buildings that are, you know, are we going to even be able to afford to heat things?
Well, those are all questions. Yeah. No, I mean, I don't have the answers for that. I mean, you know, but your observations are absolutely correct. You know, I think that we are heading into a very, very difficult time. I think the pandemic was bad, but I think that we are going to really face a lot of challenges this winter. And in relation to what you're talking about, I think it's going to be huge. Yeah. Just in relation to the health sector plan, we had to produce this under statute. So by this was produced in 2019, and essentially we look at adaptation in three main areas. It's the health of the population, the resilience of our building and infrastructure, and our emergency preparedness. And that's what that focuses on. And just for the future, we're looking at our public health Heatwave plan, the skin cancer prevention plan. That's a super one, because that's an adaptation plan, because when you think of the Sun Smart messages that we make in the summertime in relation to reducing, encouraging people to reduce their exposure to UV for themselves and their families. So that's a way of trying to reduce our burden of the 11,000 skin cancers that we diagnose every year. So those are adaptation measures, and there will be more and more coming stream. We want to, the other thing is co-benefits. I just want to mention that really quickly. All those good things that mitigation does in other sectors, for example, transport, active transport, that's great. Cycling and walking, encouraging those, that's great for health. That is really, and also for your mental health, so it improves cardiovascular and respiratory health. So those are really good things. And whenever these sectors, these big sectors, take the health co-benefits into consideration, all of the strategies that they're going to make or take in the future are actually cost effective, because you're reducing the burden on health, and that's such a highly expensive sector to run. We need surveillance, obviously, to make sure that what we're doing is good, and to make sure that we're not maladapting, to make sure that we aren't missing anything. So we're looking at some new data sources for that. So the key points, those are the key points just in relation to climate change. And look, I'm really sorry. I know there's been a lot in this. I've put a lot of public health challenges in front of you. I mean, those are only a small snapshot of the kind of work that we're involved in the department. And I hope we don't have too many more challenges in the next few months, but unfortunately I don't believe that. Thanks very much, thank you, and I'm sorry for going on for so long. Yes.